Thank you, Mr. Levin. I appreciate that. It's a little interesting when we hear our friends come to the floor with the same talking points. My good friend from California talks about the government takeover of health care, which, of course, PolitiFact called the 2010 political lie of the year, allowing 33 million additional Americans to have access to...
Point of order, Mr. Speaker.
State your point.
The gentleman made a personal reference to me, stating that I made a statement on the floor and then called that the biggest lie of the year. Is that, in fact, an appropriate comment to be made on the floor during debate?
Mr. Speaker, he's not...
Gentleman will suspend.
Gentleman will suspend.
I'm asking the question, and I'll make the point of order.
The gentleman from California has not stated a point of order. Would you proceed, state the point?
I would make a point of order. The gentleman has made a personal reference to me and then followed that up by saying that what I said was a lie.
Is the gentleman demanding the words be taken down?
Not at this time, Mr. Speaker, but I would ask that the Speaker would admonish members not to question the motivation of other members in reference to any debate that's taken place.
Mr. Speaker, I would suggest that people listen to what I said.
The gentleman from Oregon will proceed.
What I said was he claimed the government takeover of health care, and I said, which was judged by PolitiFact, an independent journalistic effort, the Republican claim of government takeover was the 2010 political lie of the year. Now, if the gentleman feels uncomfortable...
Mr. Speaker, I ask the gentleman words be taken down.
The gentleman will suspend. The gentleman from Oregon will take his seat, and the clerk will report the words. Does the gentleman from Oregon seek recognition?
Seek unanimous consent, Mr. Speaker, to withdraw the previous statement.
Is there objection? So ordered.
I appreciate...
The gentleman may proceed.
I appreciate the opportunity, because I want to be very clear about what I intended, what I thought I said, and I think a review of the tape would reveal. I'm not calling anybody a liar. What I said, intended to say, and I will ask unanimous consent to put in the record, is that as we have repeated talking points about a government takeover of health care, this has been judged by an independent journalistic undertaking as the political lie of the year. I'd be happy to yield.
All I just want to make clear the record, I never made a reference to the government takeover of health care in my speech, and the gentleman was errant in making a personal reference to what I had just said.
I will be happy to proceed. I apologize if the person who said government takeover of health care was not you. It is repeated so often by my Republican friends, including the Speaker of the House, time and time again, that sometimes I get confused because it is a litany that is used. It is, in fact, and I would ask unanimous consent, Mr. Speaker, to put in the record the PolitiFact article, because those words are still echoing in the chamber. It has been said by my friends,
without objection,
somebody on the other side of the aisle earlier. PolitiFact editors and reporters have chosen government takeover of health care as the 2010 lie of the year. They chose it as the year's most significant falsehood by an overwhelming margin. The label, quote, government takeover, close quote, has no basis in reality, but instead reflects a political dynamic where conservatives label any increase in government authority in health care as a takeover. They point out the law that Congress passed, parts of which have already gone in effect, rely largely on the free market. Employers will continue to provide health insurance to the majority of Americans through private insurance companies. Contrary to the claim, more people will get private health insurance. Government will not seize control of hospitals or nationalize doctors. The law does not include a public option. It gives tax credits to people who have difficulty affording insurance so they can buy their coverage from private providers. It relies on a free market with regulations, not socialized medicine. We have concluded it is inaccurate to call the plan a government takeover because it relies largely on the existing health system of coverage provided by employers. Mr. Speaker, part of what we're seeing here, though, is this drama that is pulled out where talking points are repeated in an effort to obscure the facts going forward. We have, the majority knows that the Democrats have attempted to adjust the 1099. We don't want it in there. We voted for fixes. It will be fixed between the House and the Senate. What's killing small business is the crushing burden of health care they're trying to provide for their employees. What is killing small business is that they can't compete with big business. They have a system that has provided a downward spiral. What's providing the driving force for the government deficit is increasing costs of providing health care, for example, through Medicare. This used to be an area of bipartisan cooperation. The Health Care Reform Act includes every significant area of reducing health care costs as either a pilot or a demonstration. It points a path towards saving hundreds of billions of dollars. Those used to be bipartisan. I have
an additional 2 minutes to the gentleman.
Thank you. Those used to be bipartisan. But instead of working with us to refine and accelerate the provisions, people are trying to put sand in the gears. And as my friend from Michigan and from New York have pointed out, there are going to be some, we hope they're unintended victims, but they're going to be innocent victims. People in the middle class and near middle class who don't have the control of billionaire hedge funds to control their income. There are things that can happen that will adjust it up or down. There will be a significant penalty. We've worked to fix that cliff. We've approved it. We don't need to reinstate the cliff. The tax on honest mistakes, as has been pointed out, there are provisions to deal with fraud. This is part of the drip, drip, drip to try and undermine health care reform, not accelerate it. It's a part of misrepresentation politically that the American public, frankly, don't deserve. It's a lost opportunity for us to reduce the deficit, improve health care, and lower costs. This is very personal to people like me. I come from an area of the country that provides high-quality health care at a low cost. My people are penalized. The health care reform is moving to try and help people like that as we overall improve health care around the country and protect the deficit. I am sorry for any ambiguity or misunderstanding from my comments, but I am frustrated when I hear the Republican side of the aisle continue to repeat this political lie of the year. It doesn't help the debate. It doesn't help us move forward. And we're going to have to move forward to solve the problems of this country. Thank you, and I yield back.